on, please let us know where you're logging on from. This evening, we are so thankful to have Dr. Johnson Liu join us. He's an adult SDS hematologist. He is currently the Director of Hematology at Maine Medical Center. Dr. Liu just moved from New York. This show is brought to you by the Shwachman-Diamond Syndrome Foundation, supporting patients and their families around the world. Thank you to all the doctors and board members who helped scramble to get this show ready for this evening. Remember that this show will be uploaded to YouTube. Please do not post any private questions. We will also not be answering any very specific questions. We have a lot of questions to get through tonight. So please keep them very general and related to this virus. And Dr. Liu is a hematologist, so just a reminder of that.
Thank you to everyone who has sent in questions for this show already. We've gotten a lot of really good ones. Feel free to ask questions as we go. There's a chat on whatever you type on your screen shows up on ours, so we'll be able to see them and answer them. And we want to know how things are going in your area. How are you doing? How are you holding up? Are you on the struggle bus? Are you bathing in toilet paper? What's your status?
Know what I realized today, Michelle? Meat, specifically chicken, is the new toilet paper. People have moved from hoarding toilet paper and now they're hoarding chicken.
That's really interesting. That makes sense, I guess. One thing I saw that was really funny, our local grocery store had put a sign in their hot sauce aisle that said, "Beware, we're out of toilet paper." And I thought that was, they're making the best out of this situation, I guess. Make sure also when you're logging on, tell us where you're watching from. We love to know our reach and our spread and how it's going. Nicole, I love it. Every couple seconds, you have a tiny Roman head popping right over your shoulder. And I think that's the best part about this show, though, is that you guys, a lot of you know us, but we're just two moms. I'm sitting in
here. Decided we did not need a babysitter tonight. So, yeah.
We're doing great. I'm in my shoe room. You've got a kid in yours. It's fine. This is real life. This is what we look like. This is absolutely what we look like. All right. Well, we have a lot to cover this evening. So should we bring on, someone's from Australia. I like that.
Oh, that's awesome.
I don't know if we've had someone from Australia yet. We're international. Oh, the question is
close the door. That was a first for me. If you guys remember the first show, we said that we may eventually have a tiny human behind us. So that was my first tiny human spotting.
It was. The first show we had a flamingo.
Oh yeah, we did have a flamingo. We have people from Boston, Ohio, Australia. And just a reminder, I'm logging on from Houston, Texas.
And I'm logging on from, I guess, technically Whitehall, Michigan, which is
Dr. Liu in Maine.
Mm-hmm. Which we've hit 2 time zones tonight. So that's...
Yes.
So I guess why don't we jump right in? Why don't we get started? Let's welcome Dr. Liu. He is, again, the Director of Hematology at Maine Medical. Hi.
Hi.
Okay, Dr. Liu, we have a lot to cover this evening, so let's get right on it. Hi, Roman. You're doing great. Everyone's great.
Why you have multiple children?
You're doing great. It's fine. I love it. Thank you so much for doing this on such short notice. We wanted to get this out as it's ever changing, but we wanted to get a handle on it in the beginning because, as you know, our families are somewhat used to this, but it is still a little scary for us. So thank you for being with us.
It's my pleasure. So I just wanted to make a little statement before we get started that, again, to reiterate that I'm actually a hematologist, so I'm actually an adult hematologist, and I've had a long-standing interest in inherited bone marrow failure syndromes and particularly in Shwachman-Diamond syndrome for some years now. But I am not a infectious disease specialist, and so therefore the things that I'm going to be saying are largely just general information. A lot of it is available on the website that I circulated the URL for. So it is cdc.gov/coronavirus/2019-NCOV. Okay, this is CDC's website on coronavirus. They actually also have daily updates on coronavirus that are very helpful. They come directly from CDC, so this is one of the best sources for information generally.
And we will have that in the comments, as well as scrolling across the bottom of the screen for viewers. They don't have to feel like they have to remember it.
Right.
Dr. Lou, that information is so critical because things are changing by the day. So it is important to check out that website, and reminder that this is our recommendations for today. Things can change tomorrow. Dr. Lou, we have a lot of.
Yeah, I also wanted to point out that the local recommendations in your particular areas are going to be very key, because the way that the virus has been spreading across the United States is place by place. So different places have entirely different recommendations and viewpoints. So it's very important for you to be aware of the situation in your particular place.
Right, and as always, consult your personal hematologist or doctor.
Absolutely.
Dr. Lou, if we could start with your understanding of the novel coronavirus and are SDS patients at higher risk?
Okay, so as you're aware, this coronavirus is a new virus that first appeared in China and now appears to be spreading to the Middle East, to Italy, and across Europe, and now the United States as well. So basically, the virus, at this point in time, I think that there are approximately 150,000 people that are infected worldwide. And in the United States, that number is currently at around 2,000 as of March the 15th. And so we know that worldwide, there has been, unfortunately, a global fatality rate that's on the order of about 2%. Okay, so when you compare it to other kinds of viruses, okay, it's important to consider this in the context of other viruses that people have dealt with in the past. So influenza virus and the flu virus are the same kind of virus. It's primarily a respiratory virus. So essentially, a virus like SARS, SARS, which was the severe acute respiratory syndrome virus that appeared previously, had a fatality rate that was actually higher than coronavirus. So basically, that virus's fatality rate was actually somewhere in the order of 20%. So essentially, the virus had it affects a lot of people, and so basically, it's now considered to be a global pandemic. But in 80% of the people that develop this infection, they don't have particular symptoms or problems that are any different from a typical viral infection. So they clear the virus, and then they don't have the severe problems that occur later on. Now, this virus is also interesting because there's actually apparently a correlation between the age and the severity of the symptoms. So as you get older and older, particularly as you get past the age of 80, that is when severe symptoms actually can lead to, hospitalization and even death, unfortunately. So basically, the virus, in terms of the major risk factors, seem to be, people that are elderly. And it's a little bit different from other viruses, because usually other viruses that have occurred in the past in this type of way have targeted children and elderly. And this particular virus, for some reason, the severe symptoms seem to occur mostly in the elderly rather than in young children. So that is a very big difference from a biological standpoint, and we're not sure exactly what that means, but that is something to keep in mind.
Definitely. So some patients have neutropenia and lung issues. Are they at higher risk than just maybe a patient with neutropenia?
That's a complicated question. So basically, there's not a whole lot of information about this. I actually did a little bit of research and reading about this, before tonight's broadcast. So the American Society of Clinical Oncology, which is the abbreviation is ASCO, has published recently some guidelines on cancer patients. And so that's sort of the closest thing that we can get to the situation of patients that are developing neutropenia. Now, there's a difference between the neutropenia that develops from chemotherapy, which is considered a temporary form of neutropenia, and a patient with a disorder like SDS, which of course is mostly going to be a relatively stable, permanent neutropenia in some individuals. Some patients don't have a very severe neutropenia, but others do. And so basically, you can imagine that as a whole, it's not entirely clear. I mean, the ASCO guidelines were based on some studies that were published from China, which is where the outbreak started. And there were a number of cancer patients in the Chinese cohort that was studied. There did seem to be, there were some cancer patients, including some patients with hematologic malignancies and who were also neutropenic. They did have the development of coronavirus infection, but it's not entirely clear exactly whether there's a direct correlation between, just stable neutropenia and the development of the infection. So the long and the short of it is that it's not clear at this moment in time, whether that's the case. But, just as a general consideration, you could imagine that, for example, people with underlying lung disease, people with medical conditions that, affected the immune system, such as diabetes, elderly people would be the people who are most at risk. And perhaps, that would include patients with, bone marrow failure and neutropenia as well. But it's not entirely clear from what has been published thus far.
Right. So some patients have the neutropenia, the lung issues, and the diabetes. So that's something probably to keep in mind.
Right.
Yeah.
So if you go on to CDC's guidelines, they actually have a very clear section, which is very, very nice. So they break it down to, they have a section on how to protect yourself and a second section on if you think you are sick. And then it goes over symptoms, the older adults and medical conditions, and how to prepare your family. So essentially, I would say that if you're having a lot of questions like this, that I would definitely check out the cdc.gov website, because they actually have very clear information, which is simple and easy to understand.
I had a call with our president, Joan, before this show about, people are confused where to go, what information to believe. There's a lot of information out there. Some people feel like they can't trust information coming out of certain countries or certain sources. And Joan said to me, all of the doctors were saying, go to the CDC, go to the CDC. So I'm really happy that you're saying that, because the patients and the families need to know a source to go to. Thank you.
Right. There's a lot of information on the web and on the news services, and unfortunately, we're now entering a period of total panic, and overload on information.
Yeah.
So in a situation like this, I feel like it's very important to go to a reputable source such as CDC. I mean,
Right.
after all, they are the experts on this type of global pandemic issues.
So we were not able to have Dr. McCaslin join us tonight, but he's the pulmonologist on our medical board. We did, however, get a quote from him, so we were able to send him some questions. He also said he's absolutely available to anyone who may need it in the future or who still has questions. We'd asked him, we know that that the coronavirus is causing lung issues. We asked what his recommendations were from a pulmonology standpoint. It's on the screen, but as well, I'm going to read it. It says general reports show children handling the illness well, even with underlying illness. The number one priority is prevention, of course. If showing symptoms, provide general supportive care with rest, fluids, and fever reducer if needed. The symptoms may worsen later in the illness than a typical cold. Refer to any action plan already established with your doctor for breathing treatments. To limit the spread, patients should avoid in-person care unless they show significant respiratory symptoms like sustained fast breathing, retractions, or trouble speaking in full sentences, and also the signs of lethargy, confusion, or dehydration. He said there's really no effective treatment for the virus, but certainly medical facilities can provide oxygen or other respiratory support and fluids as needed. Like any virus, though, symptoms should start improving by day 10. If not, that's concerning a secondary bacterial infection that may be setting in like pneumonia or a sinus infection and would be a reason to reach out to your doctor. He encourages families to call for advice if not certain, yet if they should seek care and look at telehealth services as options to limit the spread as well, which I think that's a very good idea. As we had a couple questions come in, when should we go into the doctor? And to know that, if you want to go in and get tested, you have to check with your state and see where it's available. However, that there's really no treatment for this other than rest, fluids, oxygen support, and lung treatments. So that was kind of reassuring.
We're so thankful that Dr. McCaslin was able to give us that statement.
Absolutely. He was our personal pulmonologist for years. The picture you saw of him was with him and my Nathan, and he's still one of the best doctors on our team, even if he's not really technically on our team anymore. Nicole, I know we're supposed to break in a couple minutes for questions, but we had quite a few come in. Should we grab some?
Yeah.
Okay. So Dr. Liu, one of the questions we had was, my son's cellularity has dropped below 10%. What extra precautions beyond the normal protocols should we take? And that kind of goes in line with a couple of the other questions. Should SDS families have any other specific precautions? When should they go into a quarantine or isolation? And what if they're just neutropenic in general?
Yeah, so I wanted to point out that for people who are neutropenic, even if we didn't have this, pandemic that's going on at the moment, the considerations would be the same. So basically, the most important thing from the standpoint of someone with SDS with neutropenia is, are they having symptoms that are suggestive of this kind of an infection? In other words, the symptoms would be, and they can appear 2 to 14 days after exposure. They would be fever, cough, shortness of breath. So essentially, these kinds of symptoms would be an important thing to recognize and be aware of. So for example, the difficulty breathing or shortness of breath, pain or pressure in the chest, confusion or inability to arouse, and bluish lips or face. So these are things that you would want to be aware of, and if this occurred in the context of, someone with neutropenia and fever, you would definitely want to be checked out and would want to seek medical attention. That's the single most important thing that I can think of that you would be able to do. Now, as far as what kind of preventive measures are concerned, that's primarily, that's a combination of both the local situation as well as, the circumstances where, does the person actually have signs or symptoms of an active infection? So if that is the case, then they should seek medical attention, and also they would need to be perhaps, supported, if they were having serious kinds of respiratory problems, such as we're talking about. And then the second point would be, What if you don't have infections, but you're just, any kind of symptoms like that, but are just having neutropenia and not having any kind of symptoms that are suggestive of this infection? Then there would be some, tactics that you'd want to try to go along with that would be meant to prevent uh, the spread of this virus. So basically, those are, again, there are very clear guidelines in the CDC website where they suggest steps to um, protect yourself. And basically, the best way to prevent the illness is obviously to avoid being exposed to the virus. And the virus is thought to mainly spread from person to person. So, people who are in close contact with each other within about 6 feet, if they have respiratory droplets that are produced when an infected person coughs or sneezes, and then these droplets actually land in the mouth or the nose or the mucous membranes, like in the eyes, where the people who are nearby, and they can possibly be inhaled into the lungs. So basically, this is the standard way that this virus is transmitted. So the things that you could do to protect yourself, I think, would be very clear in terms of what you'd want to do. The first thing is you'd want to clean your hands very often. You'd want to avoid close contact with other people who are sick, and obviously put some distance between yourself and other people if the COVID-19 virus is spreading in your community. So in some places that is something that's very obvious. For example, in New York City, I'm aware that the schools have just been closed, as a matter of fact, to
Sounds like breaking news.
April the 20th. So essentially, you can see that depending on the place where you live, your contacts are automatically going to be limited by the situation that you're in. Okay. Other steps that you can do to protect other people would be, if you are sick, then you should probably stay home if you can, except that if you're so sick that you're having issues with breathing and fevers and cough and so on, you should seek medical care, obviously. And then secondly, you should cover your coughs and sneezes. Instead of coughing into your hands, cough into your elbow, for example. And then also wash your hands with soap and water for at least 20 seconds. And then if you are sick, it may make sense to wear a face mask, okay? And then obviously to clean and disinfect very frequently touched surfaces. Okay, that's another possible way in which you can decrease the transmission of the virus to protect other people in the household. So for example, I'm talking about like tables or doorknobs or light switches or countertops, desks, so on, phones, okay? So if these surfaces are cleaned and disinfected, once a day, that may have some ability to prevent some transmission from contact with. So, for example, if a person who's infected coughs, and then they cough in their hands, and then they touch the doorknob or the table or something like that, there is the possibility of a transmission from that object to the person who touches that table later on. Okay, and so that's the reason why there's a recommendation, which is, a general recommendation to clean frequently touched surfaces. So those are the main issues that are currently being recommended by CDC for how to protect yourself.
We got quite a few questions about food and packaging, especially for families that are already at home. The schools are canceled. Their work is suggesting that they work from home. People are asking, should people be cleaning the bags that the food is coming in, the canisters the food is coming in? Should we go that far?
Well, I'm not sure that that's necessary or even possible, actually. I mean, I don't really know how, how you would do something like that per se. I mean, there are guidelines that the CDC has actually on cleaning and disinfection. Okay, so basically what they are recommending is actually using an alcohol-based product to disinfect. So these would be like bleach solution or an alcohol solution with at least 70% alcohol. So I don't even know if that's even feasible for, something that you would, eat. So, but I think that more important would be like things that would be very high touch, items. So like doorknobs or light switches or maybe your phone. Okay, your phone is a very big source of bacteria and viruses. So
Yes.
I would certainly consider that. And things that are touched a lot. I'm not sure that if you get a bag of groceries or something and it's coming in directly, I don't know how, I don't even know if it's possible to do that. And I'm not sure that I would have a clear recommendation about that in the light of what we know at the moment.
So we got,
But I would,
sorry.
yeah, I would say that certainly if you look on CDC's website, they actually have this type of information spelled out very clearly. So take a look at it. That is what we are trying to at least abide by to the extent that we can.
Right. So it sounds like we got a lot of questions about should people pull their kids from school? Should parents start working from home? Should a healthy sibling be pulled from school? How much isolation should families go into? It sounds like it's based on their area and what's going on in their area. Is that correct?
Yeah, that's basically correct. The thing is that in certain areas, this is already a done deal, right? So basically, as I just said, there are certain states, Ohio, and now New York City, where there are marked restrictions already in schools. So, for example, my daughter is still in New York, and she has been using remote learning this past week, and her school will likely be canceled, and it will continue as remote learning until probably April or so. So I imagine that as the as this outbreak spreads, so it's important to recognize that yes, this outbreak started in the Wuhan region of China, and so basically at this point they are already seeing a decrease in their new infection rates. Okay, so they're about 2.5 months out from the initial outbreak of the infection, whereas in countries like Italy, in Europe, and in the United States, we're in the beginning stages of this. So it's going to probably get worse. So Dr. Anthony Fauci, who is the director of NIAID, has been on record as indicating that things are going to get worse before they get better. So I would imagine that for a lot of these issues, this is going to be, the decision will be made for you in a certain extent. So the schools, for example, the local communities will likely close the schools for a period of time in areas where there is a high risk of this continuing on.
I think that's important to note for that how fast this disease is changing is that from the time we had these questions put into a document, Michigan's already closed all of its schools. I believe they're talking about limiting restaurant capacities. It's just changing that fast. I think one of the concerns that people had was if their schools aren't closed and they say that the spread rate of this is 2 to 14 days before you show any symptoms, how exactly is it spreading if you're not showing symptoms yet? Or are they just very mild symptoms?
Yeah, well, that's the tough part about this, right? So basically, there is the possibility that people with mild symptoms, may be actually able to transmit the virus because as I said before, actually 80% of people who are infected don't actually have very severe disease. It's only a relatively smaller percentage that have problems with the disease, and a much smaller percentage that actually die from this problem. So essentially, there's a lot of people who may have been infected already, and they may not know it necessarily, or it may be a very mild infection, and then they just clear it, and they're not even aware that anything like this occurred. And this may have even occurred even before there was the possibility of this having been known.
We're going to just break for some questions right now. I'll just mention some areas that people are logging in from: Australia, Boston, Ohio, Virginia, Indianapolis, Texas, Arkansas, Idaho, Connecticut. Okay, so one of the questions was, I have a SDS child who gets RSV a few times a year. Is he more likely to get this?
I don't know. So basically, it's not really clear to me, whether or not there's a clear answer to something like that. I would imagine that in the particular circumstance, I would certainly be vigilant about it. I wouldn't necessarily panic or anything like that, but I would be aware about the kind of symptoms that, your child is having. So if they do develop any of these warning signs that I mentioned previously, then I would certainly be, have my antenna up and be aware of the situation. But I don't know whether or not, there's a particular more likelihood that having had the RSV infection in the past.
Yeah, we have people logging in from Germany. One parent asked, parents that work in the healthcare field, specifically the emergency room with direct patient contact, what should they do to prevent bringing it home to their SDS child?
That's a hard one because for example, you asked about whether or not people should go to their jobs. Basically, I have patients to see. I'm on service actually in a week in the hospital. So I'm not going to be staying at home. I think the most intelligent thing that you can do is, again, goes back to what I was saying before. So, obviously, if you're in a situation where you are very likely to have contact with coronavirus infected patients or individuals, then it makes sense to, most institutions that I'm aware of, most facilities that I'm aware of already have very extensive policies that are ongoing right now. So basically, I know that my institution, Maine Health, has had a number of different guidelines that have been established for the people who work at the hospital, people who work in emergency rooms, people who are dealing with the infected patients. There's all kinds of different situations where it would be necessary to, try to go with the guidance at your particular facility, and then obviously be very aware of your own symptoms and your own body, to make sure that if you, for some reason, come down with symptoms that are suggestive of this, then you may need to be evaluated and tested. Okay, but as far as the general things that could be done, I think that there are certain kinds of recommendations for that seem smart to me. So if it would appear that if you're in a high risk situation, then you're probably likely already having guidelines with respect to how to handle that situation. Whether that is with personal protective equipment such as N95 respirators or positive pressure respirators and so on. Those are things that your institution should be helping you with to deal with. Now then, when you come back home, then the same kinds of things would apply as with other people, right? So you would want to make sure that you were trying to clean and disinfect, to avoid people who are overtly sick, right? So if you, for example, do develop symptoms that are, cough or shortness of breath or fever, then of course you would not want to, transmit that to the other members of your family, right? It's only common sense. So I think that, there's a little bit of uh, I think it's necessary for us to pay attention to what each of our institutions is asking of us, and trying to work with that, with our own situations.
Yeah. We have people from Boston, Houston, Colorado, New Jersey logging on. Another question is, my sister is an admin in schools and was in several schools where people were affected. She has been waiting over a week for testing. She has called dozens of times and cannot get a test.
Yeah, that's a tough question. I mean, I know how people have been very frustrated about this, so basically, unfortunately, my impression from, looking at the news literature, looking at CDC's guidelines themselves, and also looking at our own institutional policies, are that, yes, it's true that different institutions are now going forward with testing, and the ability to do that is still a little bit up in the air, because to this point, most of the testing has been done by CDC itself, okay, rather than from like companies like Quest Labs or something like that. So essentially, to this point, most of the time, it's been reserved for people who are where they are sick. They have these symptoms of fever, shortness of breath, or cough. They may even be have respiratory compromise or chest pain, so on. Obviously, those are situations where you would like to know whether or not this is COVID-19. And so, in those circumstances, I am aware that certain institutions have the ability to do the testing depending on where you are and what kind of resources are available. However, it's still a problem, because it's true that generally speaking, the testing still isn't that widespread. And I think CDC has been a little bit wishy-washy about the exact circumstances where they would recommend testing. They have been indicating that testing is indicated for people who have very severe symptoms. And so though that would currently be, I guess, the situation where you'd want to know.
There's a couple of transplant. Oh, sorry. Go ahead, Nicole.
No, you go.
There's a couple of transplant families that have logged on. One has asked if they should continue to allow speech therapists to come into their home for therapy, or should they be taking better precautions?
Say that again now.
So a family had asked if they should continue to allow speech therapists to come into their home for therapy as long as the therapist is healthy, or should we cancel in-home therapies for the time being?
Well, I mean, I think that if it's in a relatively higher risk area where there's a lot of cases that are exploding, so for example, there's been a truly an exponential rate of infections, that's been going around in the United States, right? So I would consider that, if possible, maybe it would be best to temporarily suspend that if it's not something that's going to be immediately, needs to be done right away. I think it's more of a common sense type of issue rather than a hard, answer one way or the other. I think that it would depend on the situation. So, for example, we're already doing things like schools that have been closing shop and doing remote learning now, right? So if you think about it, it 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 may make some sense to try and restrict things if possible, if it's not something that's, directly, urgently needed, at that moment. I think that, I would use your common sense. I think that most people have a pretty good sense of sort of like things that are red alert critical and things that maybe can be suspended for a short time,
Yeah.
or even another way of doing it, perhaps.
What would you define as a high rate of cases in their area?
Well, so for example, I mean, there's some interesting articles that I would want people to take a look at. I sent you a link, by the way, for a YouTube video that had the CDC's infectious disease director talking about who should be tested for coronavirus. Okay, because I think that if you look at his video, just to return to the prior question, I didn't completely answer it because the reason why I didn't is because, number one, I think the answer is still a little bit unclear at this moment in time. Okay, so I don't know if you can, circulate this YouTube link, okay, that I just sent to you. So,
Thank you.
Your question again was relating to
What would you consider a high number of cases in your area? And is area like your county, your town, your state?
Yeah, I mean, it's likely that ultimately, many people are going to get coronavirus infection, right? As I mentioned to you before, there is the likelihood that as this infection spreads across the United States, and it will probably, then there will be more and more states and more cities where there are people who are infected. So essentially, I think it makes, sense, however, to be a little bit watchful in areas that we know are quite active right now, right? So for example, in the United States, Washington, California, and Louisiana, New York, are all states where, this has been seen, and also Florida. So essentially, there's a map, that you can see in the New York Times. There's an article on the different states that have been affected at this point in time. But you can imagine that gradually, this is going to be in many communities beyond that. I mean, you probably have to be in the middle of a very, very sparsely populated area to not be affected at all. Even here in the state of Maine, there have been 3 presumptive cases already. So basically, I imagine that it's likely that there will be more and more cases in the future. And as that occurs, then the local governments, I guess, are going to be needed to make decisions as to what things to restrict and so on. So we already see that in New York City, the concerts, any kind of gathering of over 50 people, has been discouraged and even restricted. So essentially, this will be a local thing that will change over the course of time. So depending on where you live, what I mentioned now may not even be relevant in a few more weeks. Maybe it's going to be already at a certain other location. Okay, but what's important to realize is that it's important that we, if you look at it from a macroscopic level, from like 30,000 feet, trying to look down on what's going on, at your particular community, right? What the epidemiologists and the people who study these kinds of epidemics, what they're concerned about is primarily that we need to flatten out the curve of the infection, so that it doesn't overwhelm the ability of the healthcare system to deal with patients, right? So basically the problem initially is that, before people realized what was going on, this completely overwhelmed the health systems, in countries like China and now apparently in Italy. So basically, we'd like to try and flatten the curve out so that, for example, if you avoid certain kinds of crowds and mass gatherings of over 50 people, which is the current recommendations for what's called social distancing, right? Which is the new term that people use for trying to avoid crowds, right? Social distancing. So the idea behind that is that it's not that you're going to prevent people from getting infections ultimately, right? Because sooner or later, they likely will be infected. It's just that there will be a group that will be infected first, and then hopefully if you do enough social distancing and try to flatten the curve out a little bit, then by the time that the next group of people get the infection, and then the next group, and then the next group, ultimately these will be below the threshold where you overwhelm the health system for trying to take care of people. So basically, that's the idea behind trying to prevent transmission of this infection, but not necessarily entirely, but to try and slow it down and flatten this curve out, right? Because ultimately, we may all become infected, or very nearly everybody will be infected, but hopefully enough people will have, entrance into the medical system. They may have been treated already. They may have recovered from it, and now they have immunity, and so on. So basically, the hope is that there'll be a flattening of this curve, so it isn't as immediately harsh of a problem as it otherwise would be.
One of the questions we had come in said that the National Neutropenia Network advised neutropenic patients with an ANC under 1,000 to consider starting Neupogen dosing. Do you have any thoughts on this? This family had recently stopped due to marrow taxing.
Yeah, I do not know. I'm not aware of such recommendations. So basically, I had mentioned to you before the ASCO guidelines on cancer patients. So there is almost no literature that I'm aware of about this particular topic. So basically, I do not know whether or not, I would recommend, just prophylaxis on the basis of numbers in an attempt to try and prevent them from developing, this infection. I mean, I am very uncertain as to whether or not that would ultimately be successful. So I'm not sure. So the other thing to realize also is that neutrophils in general, are usually thought of as protecting against bacteria and fungal infections predominantly, so that how they operate in terms of preventing viral infections, we don't even have that good of a feel for. Okay, so basically the immune system is largely the system that is generally involved in protecting against viruses. So for example, if you are immune suppressed, your lymphocytes or your immunity is suppressed, that may be different from having a low neutrophil count per se. So I do not know whether or not there's any kind of evidence that would suggest that kind of recommendation right now.
Okay. We talked a little bit about when schools close and if they eventually close. With that being said, should parents start working from home if they can?
I think that largely depends on, even if you're able to do work at home. I mean, it does make sense to a certain extent that, if you work at a job, for example, where something like that is possible, it may make sense for a limited time to consider, as I said before, this kind of concept of social distancing, right? So doing things remotely or online and so on. I know that, for example, there's some talk about the the employees of the U.S. government, if they're able to do their jobs remotely, possibly doing that. So it does make a little bit of sense in certain circumstances. But on the other hand, I appreciate the fact that, there may even be people who are parents or patients who are healthcare workers themselves, so basically they may work as a dentist or something like that. It's not possible to do that remotely, just like I'm not going to be working remotely if I'm supposed to be in the hospital taking care of patients, right? So essentially, I guess that if it's possible, maybe there would be some value to considering that. Yeah.
We're going to skip to a question from our support page, sourced from our support page. My husband sometimes travels with work and has recently been to an area in the U.S. where the coronavirus is. Mind you, we sourced these questions days ago. There's not many places that it isn't at this point. If he feels that he really must travel, I'm wondering if we should isolate ourselves from him for at least 14 days.
Well, that's a tough one. For example, you could make the question even harder, right? What, for example, if somebody returns from, let's say, Italy, right, and they just came back to the United States, what kind of recommendations would you have? Basically, I think that again, it would depend on whether or not they were sick, and it might make sense to have a limited quarantine of the individual if they were in a very, very high rate area. They'd return back from, I don't know, Washington, the state of Washington, that is, or for example, they had returned from Italy. That kind of thing might make sense to be at least aware of them, and perhaps try to have some kind of limited isolation or limited quarantine, self-quarantine, to the extent that that's possible.
Another one of the questions from our support page was, is it more beneficial to keep a previous doctor's appointment or perhaps move all non-essential appointments at this time?
Yeah, I think that in a limited way, I think that I would certainly consider something like that. So one thing that I would do is to check with the clinic or the group that you're going to have the appointment with. If it's something that's very routine, you would certainly want to let them know that, you have some concerns and you'd like to have some guidance as to what they would like to do. It's also important to realize that they would like to know too, right? So basically, I'm starting on my hematology clinic tomorrow morning, right? And we would like to know if a person coming in has any symptoms that are suggestive of this kind of problem. So at most institutions, there are going to be triage. There will be people that will be taking phone calls from you, the patients, and then trying to decide, is it okay to move it to a slightly later date, or would it be necessary still to keep the appointment? And also, the CDC has made suggestions that it would be reasonable to, for example, keep a stock of food and medications for a period of time. It's unclear as to how long, but perhaps a month or two of medications at least would be nice, so that you didn't have to constantly be trying to obtain those. So therefore, I think that those are kind of common sense type of things that I think I would consider if possible.
And I know our healthcare system, our children's hospital, is moving a lot of their appointments to those teledoctor appointments if they're not necessarily needing, ultrasounds or x-rays or even doing remote lab draws and then having the appointment. They're trying to do everything they can to really make that social distancing, as effective as possible.
Right. Many institutions already have policies in place. In fact, I would be shocked if they didn't. So basically, if you contact the office, that would be the first step.
Definitely. Someone had asked, is it safe to travel with my SDS child?
I'm not sure. Safe to travel in around the country or what?
I would think domestically. I would hope not internationally right now, but I would think domestically.
Well, again, I think I would use a common sense and a limited amount of like, certain kinds of judgments and so on, in terms of trying to decide. So, for example, if it's going to be in an area that at the moment is very, very hot, such as the state of Washington again, or California, um, I would certainly think twice about it, unless the trip was very, very important. And also you know, but if it's to, if the trip is, for example, had already been planned and is very important or something like that, I might consider it if it were to an area that wasn't particularly, infected at the moment in time, But I would use my common sense about something like this, and also to be truthful, a lot of things have been canceled. A lot of meetings have been canceled. A lot of including the SDS Congress, unfortunately, which was supposed to occur next month. We know now it's been canceled. So I think that the decision-making process has already been done for certain things, and so um, I would use my common sense about something like that.
That's a very good answer. One of the questions we had was H1N1/swine flu was a huge scare a few years back and is now our typical flu A. Do we anticipate the same thing to happen with this strain of coronavirus?
We don't know the answer to that. So basically, I don't want to make specific comments about infectious diseases because that's not my area of expertise. All I can say is that you can see the pattern that's been going around with viruses of different kinds like these, right? This happens to be a virus that has, as I mentioned before, unfortunately has about a 2% global fatality rate, right? But on the other hand, if the virus is very, very infects a large number of people, we're already at 150,000 people around the world that have been infected at least. So basically, that's a large number, right? So versus another virus like Ebola virus, for example, Ebola virus is one of the most deadly viruses. It has a fatality rate of almost 50%. But thankfully, it's a very rare virus and it's very, very uncommon. So you can see that, what the considerations may be. But I can say one thing is that between SARS and MERS, which is the Middle Eastern Respiratory Syndrome virus, and Ebola, and now the COVID-19 or coronavirus, you can see that we're seeing this kind of global pandemic pop up more and more frequently. So I certainly feel like this isn't something that um, is surprising. It's not. And the thing is that what concerns me most is that I worry about the United States and our country, being prepared for something like this.
Yeah, definitely. Do you think right now, if patients do have to go to the hospital for any reason, should they be wearing an N95 mask or any other type of mask?
They're going to give you the hospital or the institution where the person will be going to will give you guidance about that. Okay, so basically, generally speaking, at most institutions, if you are going to a clinic, for example, or something like that, you'll be issued a face mask if you're having any symptoms or anything like that. But it's unlikely that you'll be given an N95 mask. For one thing, that is a special mask that requires special fitting to work. And so um, your particular hospital or institution will have very clear guidelines, particularly on where you're going to be traveling to. They may restrict your entrance and times when you can go to the hospital to visit and so on. So all of that is going to be spelled out by your particular institution.
Thank you. Can you get the flu and the coronavirus at the same time?
Well, the influenza virus isn't the coronavirus. So I imagine it's possible for a person to get influenza virus and then later on get the coronavirus or vice versa. So I imagine it's possible. Um, I've even read about one or two cases where a person seems to have tested for coronavirus twice. So I suppose that there are two possibilities. I mean, one is that maybe the second test was done at a point when the person was still infected the first time around, or second, that the immunity was incomplete against the virus. Because normally, once you get the virus the first time, then presumably, if you have an effective immune system against the virus, then you shouldn't get an infection again. But I guess it's still a little bit unclear based on what I've been reading. For influenza virus, it's a different virus, so I imagine that it's possible to get two viruses. And also, by the way, while I'm at it, the CDC obviously is continuing to recommend for influenza vaccination too. Okay.
Absolutely. To your knowledge, do you know if any SDS or neutropenic patients have been diagnosed with coronavirus?
I'm not aware of that. No, maybe somebody else may know, but I don't have any personal knowledge of that.
Okay. We had one question come in. It was from Julie. My 15-year-old son has his annual bone marrow biopsy tomorrow morning in Cincinnati. We're scheduled to fly home on Tuesday night. Now that all of our schools have been canceled, do you think we should stay here a few extra days, or should it be safe to fly home as scheduled?
Well, that's a tough one. I mean, I guess that the biopsy is still to be done at in Ohio, and then the child and the family are going to fly back to Arizona. Is that right?
Correct.
So I suppose that that would be okay. I think that so far as I know, Arizona is not a particularly is not a very high hot zone as far as I know. But already you can see that the schools, for example, have already been canceled, right? So obviously people are preparing for it at the moment. But I think that it happens that at this moment in time, it probably would be okay. But I would be very watchful, obviously, about anything that's going on, and try to obviously avoid people who are overtly sick, right?
Right. So do you think it would be wise for them to, and this wasn't part of her question, but take all the mask precautions on planes, wipe down, the seat handles, just common sense type of preventative measures, especially on a plane where it could be a mix of people coming from lots of different places?
That may make some sense. So for example, to clean the area, the personal space around the airplane, that may make some sense. Again, with something that, and to wash your hands very frequently. Now, as far as masks are concerned, it's kind of controversial, actually. Some people have been saying that people who wear a mask, they have a tendency to kind of pick at their face and so on. And as I mentioned to you before, one of the ways that this can be transmitted is if, for example, you cough into your hand and then touch your face, then you may actually have the possibility of making things worse by wearing a mask and then touching your face a lot as a result of that. So to the extent that a mask may be helpful, I guess at least be aware of the fact that try not to touch your face as much. I mean, there have even been some recommendations as to how we can try to do that. I mean, it's almost an unconscious thing for a lot of people, so it's hard to do that. But certainly cleaning the area around the airplane, that makes sense to me. Yeah, sure.
We have one last question that came in on the broadcast. Sarah says, my son tested positive for coronavirus a couple years back. Does that mean he has the antibodies for COVID-19?
I'm not sure. So COVID-19 is a particular virus that was actually, the reason for the name is that it was isolated in 2019, right? So I don't know whether or not this coronavirus is the same one as the one that is currently being talked about. I sort of doubt it actually, but maybe, I don't know. So again, I need more details, and you would need to speak to an infectious disease specialist to really know whether or not that's the same thing. But there are many coronaviruses. Okay, this is a particular strain of coronavirus that was isolated in 2019, and so I don't know what the answer to that would be, but I think it would probably is not.
They think that's probably one of the reasons why children aren't as infected, right? Because they say that children are exposed to coronaviruses all the time, but this is a different.
Well, it's unclear. So actually, as I was mentioning earlier, one of the mysteries about this particular virus is that, normally viruses usually are most harmful to the extremes, right? Either very, very young children or very old people, right? This virus has a slightly different, or actually very different, pattern of toxicity or harm. And basically, there's almost a direct correlation between age and the severity of the symptoms, so that actually the symptoms are most severe in people who are over the age of 80. Okay, so basically, I don't know why that is, but the reason may be giving us some kind of hint as to what's going on with the pathophysiology of this virus.
Yeah, it's so interesting. Dr. Liu, we have one final question for you. We appreciate you being on so long with us with such short notice. For patients that are scared, for families that are scared, what is the best advice you can give them to stay safe right now?
So unfortunately, I think that the best information that I could have is probably try not to panic, right? So basically, this is something that the majority of the people, probably are going to have this infection, if not now, then in the next few years. Okay, so basically, this is an infection that will continue to rage on until a large number of people build up immunity, and this eventually stops. But you can see that already, for example, in China, which was the epicenter 2 to 2.5 months ago, they're already seeing a drop in their new cases. Okay, so that if you see that, if this pattern plays out, I think the most intelligent thing could be, don't panic, ride it out, right? Try to ride it out, and to consider first of all, the warning symptoms for a true infection, but that needs to be dealt with and is very serious. Obviously, you need to seek medical attention. And then secondly, the idea about possibly measures at social distancing and common sense type of things to try and protect yourself and your family.
Thank you so
Definitely.
much, Dr. Liu. We are so appreciative of you being on. If you guys have noticed, he's wearing our SDSF shirt. Thank you, Dr. He's repping SDSF. Stay safe, Dr. Liu. We so appreciate you being on with us tonight. Thank you.
Okay.
Thank you very much.
Good night,
Appreciate
Dr.
it.
Liu.
All right. Good night.
Good night. Michelle and I just wanted to tell you all, you know what to do. This is what you guys have been doing a really long time. Help other people. We've been washing our hands, cleaning surfaces, staying away from sick people for a really long time. Take Joan's letter from the foundation, put it on your refrigerator. You guys know what to do.
We have lots of resources on the SDSF website, as well as the Facebook page. There's hand washing charts for kids to show how effectively to wash hands. There's even little reward charts you can put stickers on. There's some door signs that say, this is the home of a medically fragile child. Please be careful, use caution, wash your hands, take your shoes off. Like Nicole said, this is what we do every day. This is the one thing I've told people when they've asked how we're doing. I'm like, this is our rodeo. This is, you guys, we do this for flu season. We do this for
rodeo. Yeah.
We know what we're doing. So go out and it's going to sound crazy, but go out and spread your calm from knowing what you're doing onto everyone who doesn't know what they're doing.
But do it from a social distance.
Social distance, yeah, 6 feet, no elbows. I know at least the Michigan website today said that they're not even, they're encouraging like no elbow bumps, no like waving from 6 feet away. So encourage people from 6 feet away, 6 feet away, 6 feet distancing.
So if you guys have any specific questions we didn't get to answer, obviously this is an ever-changing topic, please message us on the foundation, or you can message Michelle or I or Joan or any other board member, and we'll be happy to try to get your questions answered. Again, very specific questions, please ask your personal provider.
Yes, I know both Dr. Liu and Dr. McCaslin said they were open to any additional questions. Dr. McCaslin was sorry he couldn't be here tonight, but he, as a pulmonologist, said he's more than willing to help in any way that we need help. So just stay safe, wash your hands, don't buy all the toilet paper. If you need to know how to make some homemade sanitizer.
Why is everyone buying the chicken?
I don't want chicken. I don't toilet paper. I think there's more things I would buy. I would buy all the chocolate. I would buy every bar of chocolate. I don't understand why it's toilet paper.
I'm gonna end you guys with a funny story from this morning. So my son is allergic to a million things, and someone had bought up all the vegan cheese, and I'm sure it was their panic buying, and they were like, oh, all the cheese, and someone's probably sitting home with this coconut oil cheese, like, what cheese is this? This isn't cheese. So don't go buy all the vegan cheese.
They're going to be really disappointed when they bite into that, and they're like, this is not cheese. But then maybe they have a lot of toilet paper, so they're probably fine.
You guys stay safe. Thank you for joining us for 2 back-to-back SDSF Lives this weekend. Thank you, Michelle. Thank you for Dr. Liu. Thank you, Joan, all the board members that helped make this possible. Y'all stay safe.
Thanks, Nicole. Thanks, Orva behind the scenes. Wash your hands.
Wash your hands. Bye, guys.
Bye.